studios in downtown Little Rock, this is Capitol View.
And good Sunday morning to you. Welcome into Capitol View. I'm Jay Burr. Well, the governor signed an executive order last week creating the Law Enforcement Task Force, which will dive into policing policy across Arkansas. And joining us now to talk about that task force is task force member and Urban League president of Arkansas, president, there we go, Scott Hamilton, and also Washington County Sheriff Tim Helder. And guys, we certainly appreciate the time here. Scott, I want to start with you. Being a part of this task force, what do you want to sort of bring to the table here?
So, Jay, what I'm hoping that I can bring to the table is just a little bit of a voice of people here in our state, different things that they've talked about, concerns they have, really just kind of bring that voice and the things that people want to have the governor hear, the governor to consider as it relates to the current matter that we're dealing with, as it relates to, in particular, police activity.
And Sheriff Helder, I want to bring you into here too. This has kind of been an issue that we're kind of doing a lot of introspective looking into things, at least from a police standpoint here. What do you hope comes out of this task force?
Well, I don't think we're perfect by any scope of imagination, and I think that we always have room to grow. I think we've come a long way. I've been in law enforcement for 41 years, spanning time with the county and the city of Fayetteville, and so I came up during a time when there was blatant racism within the county and the police department early on, and then we were able to affect change over years, and I think we've seen some positive outcomes in the last several years, and I'm hoping that we can continue in that vein. I think by researching policy, researching methods that we conduct ourselves by, that surely, if things haven't changed policy-wise in 30 to 35 years, there are some things that are probably not acceptable today in our communities that we need to really kind of try and mold those into today's acceptability.
And I guess, too, just from your perspective being in law enforcement, what are just some of those surface level things that you think can be changed? Because as you mentioned, it's been a long time since a lot of these policies have been reviewed and even dove into.
One of the things that we implemented several years ago was a requirement for law enforcement to report. You had to report if you saw something that was out of line within the department ranks. But I kind of like the idea of requiring at a statewide level a requirement to intervene. When you see something that's wrong, as we saw in Minneapolis, if there had been a requirement in place, perhaps one of those guys would have intervened. I don't know that that's the case, but I would like to think that. So that's probably one that comes to my mind right off, that's low-hanging fruit as far as I'm concerned.
And Scott, bringing you back in here to this, I know we were actually talking a little bit last week about potentially diving into sort of the culture of things. And it's maybe not something that you can necessarily legislate or take executive action to, but what do you kind of want to look into when it comes to that culture and that fraternity of policing?
So I think that, as the sheriff said, this is going to be a conversation. I mean, it's going to really delve into what people are seeing and feeling, and then balancing it out with some reality also from how the police department see things. So, as the governor said, it's been many, many years since that any of our policies have been looked at. So it's just simply time. I think from a culture standpoint, we probably will see some things that could certainly use some work. And I think that's the whole spirit of the task force, is to work through, identify things where folks say, hey, we can, do this a little bit better. Hopefully this will make a change for the good for all, and then work in that way collaboratively. That's our objective here, is that we're working in unison. I mean, this is something that is for all folks. This is something that we as a society have to make sure that we can work through and create a operation and structure that's good for all the cultures here in the state of Arkansas.
And let me kind of get your take on this, too. When we talk about funding, and the governor made it pretty clear he's not in a position or doesn't want this to end up being a disfund or disbanding or defunding the police here, at least in Arkansas. But funding does become an issue when it comes to possibly making changes. I know body cameras are one of those easy things that people think of right off the top of their head. I guess, what do you think funding how do you think that will play into what maybe this task force wants to see, and then maybe even like what can it realistically recommend?
So, Jay, from my perspective, a lot of people are using the statement defunding. And I think, unfortunately, that's a word. I mean, we come up with words in our society, and they just get all kinds of meanings. And so one of the things I think you heard the governor say is that certainly looking at funding is fair game. And so from that perspective, what we're going to look at, I mean, every thing we have has a limited amount of dollars. I mean, unfortunately, we don't just have this bucket we could dip into. I wish we did. But when we begin to look at, where are the dollars spent? I think certainly we want to say, well, maybe this is something that would be beneficial. And we're hoping that as we look at that, these are things that we can come back to the governor and say, okay, I got these many dollars. Maybe if we shift some of them here and do this, add this, maybe change this, there may be some things that are no longer as important. But defunding is not anything that anybody's interested in, because at the last, I mean, by all means, we've got to have a good, strong force out there that protects all of us.
And Sheriff Helder, I kind of get the same thing with you here, coming from the inside here, when it comes to funding. And I know things are a little different when it comes to municipalities and then the counties. How do you think that will play into things? And especially when we're talking about maybe not necessarily widespread changes, but some changes, like I mentioned body cameras, things like that. But there are some things where funding will be an issue.
Well, first of all, to hit on the defunding part, when we all heard that in the law enforcement community, of course, our hackles get up, because we recognize that we believe that we're what stands between us and the darkness and chaos. And I think that the community overall agrees. So I think it was probably not a completed statement, but I think there are some places where the culture is such that perhaps what they're talking about in some areas is to deconstruct an existing agency and rebuild, and if it's that way, fine. But I think to paint with a broad brush, we need to get away from that kind of a statement. Now, when it comes to funding, when they start talking about body cameras, if that's something that's going to be legislated to where everybody's required to do it, it's obviously going to require an infusion of money, so that's got to come from somewhere. Like for us, it takes 2 additional people to answer all the FOIs pertaining to body camera use, redacting, and for a variety of reasons. So it's not just the purchase of the equipment; it's all the operational costs along the way. Something, Jay, that I think I ought to mention too is, would it surprise either of you that whenever the minimum wage was increased, that some deputy sheriffs within the state of Arkansas actually got a raise? And I think that when we continue to pile on responsibility in law enforcement, and we expect these outstanding results, I think that what we've got to start considering is compensation. If we're going to require more, we need to pay more and then hold people at a higher level of accountability. So I think that's one of the things that we're going to have to talk about during our conversations if we really want to affect significant change throughout the state.
Well, it's definitely a fascinating conversation to have, and gentlemen, we certainly do appreciate the time. Once you guys kind of get into some of those nuts and bolts here, we'll definitely bring you back on here and see what we can make of this task force. But again, Washington County Sheriff Tim Helder and Scott Hamilton, the president of the Urban League of Arkansas. Gentlemen, we appreciate the time, and best of luck going forward. All right. Well, COVID cases on the rise in Arkansas. Coming up after a quick break, we talk to a member of the Arkansas Hospital Association to find out if the state is prepared. You're watching Capitol View on Sunday morning.
Hi, I'm John Cossey. At Crawl Space Solution of Arkansas, we offer all things crawl spacey. If you have moisture in your crawl space, that means mold and mildew. Our Clean Space system will create a dry, healthy, and clean environment. Call Crawl Space Solution of Arkansas today for all things crawl spacey.
I only paid $37 for my glasses.
Awesome. Success Vision. It's the real deal.
It couldn't be easier.
The eye doctor next door is great.
2 thumbs up?
Yes.
My glasses feel great.
So easy. I couldn't be happier. Now that is awesome. I loved it.
It's actually fun to buy glasses.
Great feel and great look.
That's why I keep coming back. I will definitely be back.
Too bad for 39 in an hour for less. Come see us today, Success Vision Express.
When managing diabetes, you can't always stop for a finger stick. With the Freestyle Libre 14-day system, a continuous glucose monitor, you don't have to. With a painless 1-second scan, you can check your glucose with a smartphone or reader, so you can stay in the moment, no matter where you are or what you're doing. Ask your doctor for a prescription for the Freestyle Libre 14-day system. You can do it without finger sticks. Learn more at freestylelibre.us.
There are now more options than ever to enjoy Tzatziki's. Our Mediterranean menu is full of healthy and original favorites that are available for dine-in, delivery, takeout, curbside, and drive-through at select locations. We've implemented safety procedures to protect both our guests and our crews. Order online at tzatziki's.com or download our app today. Thank you for your continued support.
It's our vacation at home sale at Family Leisure. Pools, patio furniture, swing sets, spas, and more. All priced to move. Shop online, call us, or set up a FaceTime visit today. Pick up delivery and no contact installation also available. Vacation at home sale going on now at Family Leisure.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back to Capitol View. Arkansas has seen a rise in hospitalizations in recent weeks due to COVID-19. None seeing that more so than Washington and Benton counties right now. Across the state, hospitals already, if a spike hits them as well. And here to give us an inside look at that is Executive Vice President of the Arkansas Hospital Association, Jodie Tritt. And Jodie, we certainly appreciate you coming on with us here. So I guess just give us the overall vibe of up there in northwest Arkansas. What have you heard? What is Washington Regional dealing with? Benton County and even Madison County, we're starting to see a nice little pop-up in cases.
Sure. We're actually very, very proud of the communication that our hospitals have given to the communities overall as their cases have kind of increased a little bit over time. We have lots and lots of preparedness plans in place stemming back from years and years ago, just to make sure that we're always ready to work together and to collaborate when we have a kind of surge in the community, if you will. As the governor said on his press conference today, it's no surprise that we're having an increase in the number of people who are being impacted by the virus. And we, of course, in the healthcare industry loved what he said about making sure we are still appropriately socially distancing, that we are still masking to protect ourselves from one another. And that is the #1 best thing our hospitals would require and request of their communities and their individuals too. The way we keep each other safe and the way we keep each other from getting really sick is by protecting one another and being socially distanced and wearing masks. Our hospitals are absolutely prepared to take care of patients. We see patients kind of twofold, especially up in northwest Arkansas right now. Of course, you have the COVID positive patients, about 1/3 of whom require ventilators and extensive ICU care. And we also have seen a rise in the number of people who, frankly, put off seeking care a little too long. So when they came to see us, they were a little sicker than we wish that they were. So you've got kind of a twofold issue with the number of people who are in hospital beds up in northwest Arkansas right now.
And obviously, too, that surge in northwest Arkansas is very public right now. The numbers are pretty astronomical, at least from what they have been. Looking at the rest of the state, we're not seeing near the spike, near the volume. What are the hospitals sort of in the rest of the state looking like? Obviously, you said everybody's prepared as they should be because UAMS here in central Arkansas sort of kind of dealt with initially sort of what NWA is dealing with now. But how's everybody looking like currently?
You know, our hospitals do a really good job of working as a big network altogether. So while they operate in regions and they have preparedness plans that they're working out together regionally, literally statewide, our hospitals work as a great network. We built off of our trauma system in being able to transport patients back and forth and among one another. When one skill set or one type of bed is vacant in one location, we're able to transport those patients. Now, ideally, it's no secret that we like to keep patients as close to home as possible because transporting them to other locations causes a lot of problems with a lot of different scenarios. Right now, we also are in a little bit of trouble with the community, as you might imagine, because people don't love our visitor policies. Our nurses and other folks have really stepped up to do things like FaceTiming and having telehealth visitors with caretakers of patients who are within a facility. So in one strange way, it actually makes it easier to transport patients because the family members and the community members wouldn't be able to go and visit with them in a come and go nature like they used to anyway. We're still very open to a caregiver coming and staying with the patient, but that caregiver can't come and go because the risk of the spread of the disease, especially if you know that the widespread community disease is there, is just too high for not only our patients, but our healthcare workers and other people who are coming in our facilities as well.
And I know, too, that part of this has been, we've seen a surge in the Latino population. Is there anything that the Arkansas Hospital Association has done to maybe cater to that part of the population here in Arkansas?
The Arkansas Hospital Association has not done anything in specific to any population. You might know very well that hospitals treat conditions. So when you come in, whether you're Latino, black, white, purple, pink, anything, we are treating the condition of you and your person as a whole. I will say that I'm awfully proud of our hospitals because of the visitor policies and some of those things. We've really stepped up a broader aspect of just the acute care condition that we're dealing with. We're enhancing social workers. We're enhancing behavioral health needs. We're doing a lot of things to try to address the whole patient a little bit better than just treating that disease. I will say the Minority Health Commission has put out some good information. And also we know that the CDC is wandering into Northwest Arkansas today to try to help do some contact tracing and figure out the best ways to kind of stall the disease in the Latino population a little bit better.
And you mentioned some of those silver linings there in sort of addressing the health, but I do like the fact that while these hospitals do sort of, in essence, kind of compete against each other, there is a lot of exchanging of information, of even patient care, things like that. I guess, how different is that than what we normally see? I mean, obviously a pandemic will bring out the best, at least in the healthcare industry, but is that something that normally goes on, at least to this level?
You know, with trauma patients, yes, some of our hospitals share emergency department physicians now, especially in our larger areas. Arkansas, by its very nature, is very collaborative. We're lucky to have people who know one another in the community. You know, in Conway, both CEOs of those hospitals there know each other, like one another, and work well. We giggle a little bit inside the Hospital Association that one of our favorite things about our hospitals is they compete fiercely for market share, but they also compete fiercely for who can provide the highest quality of care. And our Vice President of Quality and Patient Safety says all the time, you know what's so great? We'll have hospitals who are competing with one another for market share who absolutely pick up the phone and call each other's quality improvement person to say, hey, we had this, this, and this in the community, and here's what worked out really well for us. You want to come over and have lunch and we'll talk about it. So there's a lot of collegiality here in Arkansas that we don't experience necessarily in other parts of the country, and we appreciate that very much. Just about every hospital in the state is one of our members, and so we have a high touch with them. Our board meets at least 10 times a year, and of course here lately we've been having more calls than that to make sure we're really addressing the needs of our hospitals and the needs of our patients. It's a fabulous issue and a fabulous directive that we have from our board in saying, hey, no matter what, we're putting patients first. If that means we need to collaborate on finding a rehabilitation hospital that still to half capacity that's owned by one particular entity, we'll set that entity aside for anybody in the region who needs to take patients there, and we'll collectively staff it. And that's really great collaboration, and that's happening all over the state.
Well, you certainly do love to see it. Everybody coming together for the common good here. Jodie Antron, Executive Vice President of the Arkansas Hospitals Association. We certainly appreciate the time, and we'll do it again soon.
All right. Thank you for having me.
You bet. Absolutely. All right. When we come back, we take a look at your top political headlines. You're watching Capitol View on Sunday morning.
When your normal activities are on pause, create a new routine that the whole family can enjoy. A space where you can unplug, unwind, and connect with what matters most. A hot spring spa from Townley is the ideal backyard retreat. Every day made better with a hot tub from...
Townley.
Tonight.
I look like an adult German baby.
Carson crashes game night.
I know it, I know it, I know it.
And it ain't over until the Queer Eye sings. Hollywood Game Night tonight on NBC.
We're setting the bar monumentally high. Two Titans defend Mount Olympus. Super Bowl champ Victor Cruz.
Let's get it.
And Ninja Warrior Jesse Graff.
I was born to be a Titan.
The Titan Games, Monday on NBC.
I was in foot pain for 20 years. I bought all these products, and not a single one worked. When I drove past the Good Feet store, I thought, I'm going to stop in. What can it hurt? They wanted to make sure that they gave me the right arch support for my feet, not somebody else's feet. And you just knew, like your feet just, when they got on the right ones, they were like, oh yeah. I'm Teresa, and that's my Good Feet story.
See for yourself with a free personalized arch support fitting at the Good Feet store.
The Arkansas Scholarship Lottery has some much-needed good news to share. In the last 10 years, we've helped provide more than 540,000 college scholarships for students like these. With their hard work and our support, the next generation of doctors, nurses, teachers, and others are creating a brighter future for our state. The lottery is here for students today and will be here when it's time for school. Stay safe and stay strong, Arkansas.
For the past 3 years, we have been your neighborhood bar and grill. The staff you know is still here to serve you. Our award-winning cuisine is returning with exciting new dishes. Our mixologists have crafted new signature cocktails. The patio is set up for your family and friends. The garage doors are open on the Sidewalk Cafe. Let us pour you a peachy key. We're excited to welcome you back.
Invest in yourself, create wellness, relax at home. Take advantage of Townley's special hot tub purchase program. No down payment, no interest for 60 months. Every day made better with a hot tub from...
Townley.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back to Capitol View. On Wednesday, Congress held the first hearing on police reform since the death of George Floyd rattled the nation. Floyd's brother, Philonis, was among those testifying. He's calling on Congress to pass Democrats' new bill to hold police accountable for misconduct. DC's Raquel Martin has more.
I'm here to ask you to make it stop. Stop the pain.
Less than 24 hours after burying his older brother, George Floyd, Philonis Floyd made an emotional plea to Congress, demanding systematic change.
He didn't deserve to die over $20. I'm asking you, is that what a black man is worth?
Floyd and his attorney, Ben Crump, joined a panel supporting the Justice in Policing Act. The Democrat bill requires new police training, outlaws chokeholds, and makes it easier for victims of police brutality to sue.
If officers know they have immunity, they act with impunity.
Missouri Democrat Emmanuel Cleaver says Congress must act.
Our legislation is critically important for America.
But while sympathetic to the Floyd family, Republicans say Democrats' reforms are not the answer. Ohio Republican Jim Jordan says it's wrong to punish all law enforcement over what he calls a few bad apples.
The vast majority of law enforcement officers are responsible, hardworking, heroic.
Something has to be done.
Illinois GOP Rodney Davis says Democrats need to work with Republicans to find a compromise solution.
I would love to see some of the standards that Illinois has already put in place be able to be utilized on a nationwide basis.
I'm tired of pain.
But with their brother's name now part of a growing list of victims of police brutality, the Floyd family says they won't settle for less than real change. In Washington, Raquel Merton.
Meanwhile, House Minority Leader Kevin McCarthy says Republicans are putting forward a bill to address police reform and could find some common ground with Democrats. He also says that he supports banning chokeholds.
House Republicans will be putting forward a reform legislation proposal. Part of that will be led through the Judiciary Committee with Jim Jordan and others. They will be meeting today with Tim Scott, Senator, and we will focus on three main areas: performance, transparency, and accountability.
With coronavirus cases spiking in some parts of the country, Joe Biden criticized what he calls President Trump's one-point plan to safely reopen the economy. Biden says the Trump plan merely encourages reopenings. During a roundtable with African-American community leaders and business owners in Philadelphia, Biden pitched his own list of 8 goals to keep workers safe and businesses open. Chief among those are federal programs to pay for virus testing, PPE, and hiring 100,000 contact tracers.
Trump has basically had a one-point plan: open businesses, just open. But it does nothing to keep workers safe and keep businesses able to stay open. And secondly, it has done very little to generate consumer confidence.
Biden created a stir on Wednesday night on The Daily Show with Trevor Noah by saying he's concerned Trump will, quote, try and steal this election. The White House press secretary calls that ridiculous proposition, accusing Democrats of leveling conspiracy theories. President Donald Trump plans to hold a rally in Tulsa, Oklahoma next week, the first since the coronavirus pandemic hit 3 months ago. It will be, there you see, at the BOK Center. And we're back to wrap it up after this. You're watching Capitol View on Sunday morning.
Attention home buyers, golfers, and investors. Absolute real estate auction by Fowler Auctioneers, Wednesday, June 17th at 11 a.m. 87 Montanoso Way in the gated neighborhood of Hot Springs Village. Beautiful 3,200 square foot Mediterranean-style home, custom built in 2004 on a large Ouachita Mountain View lot. Live auction will be on location Wednesday, June 17th at 11 a.m. or register and pre-bid now online at FowlerAuctioneers.com. Contact Nick Fowler or FowlerAuctioneers.com for more details.
The opioid epidemic is destroying families and communities across Arkansas. You can help reduce overdose deaths in just 5 easy steps. Talk to your doctor about pain treatment methods other than painkillers. Monitor and secure your prescriptions. Dispose of unused or expired prescriptions safely at a collection site or an Arkansas drug take-back event. If you know someone taking opioids, visit your pharmacy to obtain naloxone to temporarily reverse an overdose. Download the Arkansas app for life-saving information and resources, including how to save a life with naloxone.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
That's it for today's show. Make sure you get the Capitol View podcast wherever you get your podcasts. We're going to be right back here next week with an all-new Capitol View. So enjoy the rest of your weekend. Stay safe out there.